Trauma, Stigma, and Autism. Stigma is a form of trauma. It targets people on the basis of beliefs about them that have nothing to do with who they are. It undermines a person's humanity and overshadows the fullness of their identity by placing assumptions about negatively perceived qualities over openness to their actual personhood. Although trauma is often framed in terms of a terrorizing event, it is the perceived physical and/or psychological threat to our personhood and residual self-protection that underlies much of the suffering involved. Having our humanity threatened, undermined, and devalued is fundamentally traumatic. It can shift into a hyper-aroused state of defensive safety-seeking or a guarded withdrawal and self-isolation. Chronic invalidation can lead to an oversensitive danger alarm in the body-mind waiting to be activated by the smallest trigger. We have much to learn from autism in this regard, because the humanely erosive process of chronic invalidation is constantly at work through stigma and stigmatizing micro-events that can make us feel like crawling under a rock, or even aliens on this planet. Autistic individuals often experience the chronic assault of invalidation trauma who don't fit dominant expectations of what people are supposed to be like. Unfortunately, the long-term effects of traumatic stress and invalidation trauma will have consequences. This became trauma in the fiber of his being. It manifested itself in the form of dissociation and inability to be present in the moment when stigma became activated. Hypervigilance to rejection and high levels of physiological arousal triggered by perceived deficits of acceptance. It was feelings of isolation and abandonment during his long recovery. The quality of an individual's life can be significantly impacted by accumulated feelings of perceived exclusion, abandonment, and disrespect. When we experience repeated stigma, judgment, rejection, and/or prejudice because of qualities inherent to our personhood, qualities we may not be able to change or may not have chosen, we may end up experiencing identity fatigue, a form of complex trauma involving chronic assaults on the fullness of our humanity. A better understanding of stigma and autism not only provides a unique perspective on the widespread problem of invalidated humanity, but also gives us helpful traction to work with this difficulty. Loosening the grip of shame is possible one step at a time by managing the defensive reactions associated with invalidation trauma. That quote was taken from Gordon Gates' Trauma, Stigma and Autism book. I highly recommend this book. It's very well written. Axia is one of the few exceptions, and you are being seen as the expert on your autism. and they work in partnership with you. And axia means value, merit, worth, which is beautiful. Axia ASD UK invited Dr. Luke Bearden for a post-diagnostic support group online meeting, and it is very interesting what Luke has to say. This is taken from the slideshow by Luke Bearden. If you met one individual with autism, you've met one individual with autism. All mainstream autism theories are medical model deficit based, but very few seem to worry about this trend. Do not prescribe medication to address the core features of autism. Also, this is really weird. Psychosocial intervention may be used to help guide the person back into a healthy state of being. Exactly. That's exactly the invalidation trauma that Gordon Gates is talking about. It shouldn't be about that. Never try to alter a person's behavior and relationship with society in order to reduce the impact of the person's disorder or condition. That's bloody bullshit. Sorry. Seriously. Because then we will have masking, which is highly stressful. When an autistic has to mask all the time, just so the environment feels comfortable. What does that say about the environment? Just because somebody is a little bit different doesn't mean it has to be suppressed. It's just not right. It's again about a minority being suppressed by the majority. Traumatic, ongoing stress through invalidation trauma. It is a trigger. It is demand pressure to perform and mask in a way that goes against your core nature. What do you think will happen in your nervous system over time? It will be in a constant cell danger response. And the result of that will be chronic illness. That's why, in my opinion, Autism Evaluation should always include also PTSD assessment and adverse childhood experiences test, so you have a very clear idea if an autistic is in danger of developing chronic disease. This was a study about 20 years ago by Felitty and Anda, and they found a very clear pattern. If you have adverse childhood experiences, you have a way higher tendency to develop disease later in life. And I would say for autistics, this danger is even more obvious because we are forced to pretend to be somebody else just to fit in, which causes chronic stress. Traumatic chronic stress will lead to PTSD and, in the end, cause chronic illness. In addition to comorbidities an autistic may already battle with.
Dr. Margaret Bowman. I'm a neurologist at the Boston University School of Medicine in Boston, Massachusetts, to be able to speak to you all about my experiences with the autistic population. I see both children, adults, and adolescents on the spectrum, and have had about 35 years worth of experience with this population. What I'd like to speak to you about is some of the physical comorbidities that go along with this disorder. And most of our therapies are geared towards behavior management, speech and language, occupational therapy, teaching social skills, and for the older group, vocational intervention. But coming along with that is the fact that many of them will present with behavioral issues, which up to this point have been traditionally seen as simply part of the autism story. And in fact, as we've learned over the past 5 to 10 years, this is not the case. That certainly autistic people can have unusual behavior, but many of these behaviors can be a signal for some kind of underlying physical condition. The problem is that children on the autism spectrum, as well as adolescents and adults, do not present with the usual symptoms that most specialists would recommend or would be able to recognize easily as being medical in origin. So, for example, we have a number of disorders that we are concerned about. We know that individuals on the autism spectrum are likely to have a seizure disorder. Approximately 1/3 of individuals with autism have seizures. Not all those seizures are always obvious to the provider. They may look like staring spells, or they may look like some unusual repetitive behavior. So that is an area that is easily identified and treatable and really could make a substantial difference in the life of the patient. Secondly, sleep disorders are very common. That too can look like a behavioral problem, but could be related to, for example, big tonsils and adenoids, which don't allow the patient to breathe well and therefore keeps them awake. Or it could be secondary to some kind of gastrointestinal problem, what's called reflux, where gastric acids come up into the back of the throat and keep someone awake or wake them up in the middle of the night. And then there are hormonal issues. There are teenage girls, for example, who are experiencing some hormonal imbalance, which causes them distress, particularly around the time of their menstrual periods.
Oh, yes.
And then one of the larger areas of concern is gastrointestinal dysfunctions. This could be almost any kind of gastrointestinal problem, including constipation, diarrhea, gastroesophageal reflux disease, esophagitis, and so forth, all of which can cause some significant distress to the patient. Now, one of the problems that we get into is the fact that many of our patients are nonverbal or hypoverbal, and they can't tell us that they don't feel well. And so one of the ways that they manifest some of this discomfort is by having unusual behavior. Gastrointestinal disorders are common enough that this certainly needs to be one of the first areas of investigation in almost any patient on the spectrum who presents with some unusual behavior. One of the other challenges is that many individuals on the spectrum have sensory problems, and they cannot easily identify even where the discomfort is. A huge challenge for any individuals on the spectrum and for those people who would take care of them. So even if you had someone who is verbal, they might not be able to accurately tell you what is going on. In addition to my clinical work, I also do research. There have been at least 2 situations where the individuals have died because of a ruptured appendix that was not diagnosed or picked up, and they presented with behavioral problems, but nobody recognized that this was a healthcare issue. They simply took it as part of the person's autism. The patient was not treated and ultimately passed away. So this is in fact, a significant area of concern, and just underlines the fact that individuals on the spectrum who demonstrate behavioral problems absolutely merit a good physical, medical workup. The advantage of being able to evaluate these individuals is the fact that if you can help them feel better, they're going to do better and they will have better outcomes. And this has absolutely been the case in all of the individuals that I've seen and we've diagnosed with some kind of healthcare issue. It could be ear infections, it could be somebody broke their bone and didn't be able to tell anyone about it. It could be metabolic disorders, it could be gastrointestinal symptoms, it could be almost anything. But if we're not good at identifying it and treating it, then we're not going to be able to help these individuals as well as we could. So it's our strong recommendation at this point that that's providers who are familiar with individuals on the autism spectrum need to be recruited to work with these families and these patients in order to provide the interventions that they need that will allow them best outcomes.
What autistics indeed need is acceptance, quality of life, feeling that they belong, and being surrounded by understanding of autistic needs, not invalidation or gaslighting. Autistics may have tremendous difficulty to communicate their needs, but if you are actually gaslighted, told that what you experience, you don't experience, this will add a lot of trauma. What you are programmed to is to disregard your needs and to shut up because nobody takes you seriously. And sometimes it really isn't the autism. Sometimes it's really some physical issue that needs treatment, and it needs to be taken seriously and not invalidated as autistic behaviour.
Rebecca Burgess, actually, I kind of like her explanation that she uses that kind of circular light spectrum whereby someone can place on that circle anywhere and that there's no hierarchy, there's no assumption of capacity or lack thereof. What's your opinion of the use of the word spectrum, and particularly, I suppose, that view of a spectrum in a linear manner?
Yeah, so you've nailed it already, actually, to be honest, Sharon. It's the use of the term spectrum is entirely based on the way in which a person actually uses it. And unfortunately, the majority of people still, I think, see, like, people can be very visual. It's not just autistic people that are visual thinkers, but a lot of people, when you say the word spectrum, they see rainbow, they see this kind of linear progression. Yeah. If people see autism in that way, then my view is that that's at the very least misleading. I don't think it's helpful to try and grade where somebody is on the spectrum for any number of reasons. It starts to infer that there's functioning labels are appropriate, which frustrates me. And I know there are a lot of people who are vehemently against what I say. I absolutely understand that. And people say, no, my child is severely autistic. What I think that means is that the impact of autism within that particular environment might be severe. Yeah. And I think also there are often other things in play, like intellectual learning disabilities, or the individual might have comorbid difficulties with something else as well. So, but autism in and of itself is just autism. I don't think that it's useful to grade it in that sense. That's why the idea of a continuous circle is actually fantastic. That's a gorgeous image, but actually the term spectrum doesn't evoke that image for most people.
Absolutely.
So just to clarify, the reason why I'm not a fan of functioning labels is purely and simply, if you apply a functioning label to a person, people will then assume that is their functioning changes all the time, literally from minute to minute, day to day, year by year. So to actually say, right, you are functioning at this level, full stop, is extraordinarily misleading. It either raises the bar too high or raises it too low, and it will change anyway. So an autistic person might be functioning absolutely brilliantly in one environment, say, for example, in one school, and then they change school and they have huge levels of difficulty, and all of a sudden their functioning goes down. They're the same person. So to try and apply that label across the board, to me, is nonsensical.
Absolutely, absolutely.
For me, this is very true. Already as a teenager, I had to change schools, and my grades were very low at the first school. Then I changed into a private school where the teachers were somehow nicer or more supportive. And back then I didn't know that I was autistic, but still it just felt safer in this school. And my grades went up. And the same goes for the lockdown situation. Right now, not going to work, but staying home most of the time. There is very little exposure to noise, for example. So I even measured it at work. The decibel is around 70 to 85, and at home it's around 29. At night it's even less. So that's a huge difference, right? And that's just the sound. And for that reason, my nervous system is not that stressed. And the result of that is I am very creative. I am cheerful. I am way more balanced. I have very few meltdowns. And those meltdowns I had were triggered by an external reason. It was always coming from something that really stressed me out. Either it was work or the situation with my mother. Apart from that, so you see, really environment is very, very important. And when your environment is adjusted, you function way better. And your nervous system is more regulated. It's common sense. When you don't feel stressed, of course, you will thrive. If you have the necessary support by people who understand your needs and know you and hear you and see you, this will give you so much courage. It is very important to have that network of support. This is the same for autistics as well as non-autistics. But because we autistics are a minority that doesn't really fit in, that has a different way of expression and socializing, feeling validated by people that make you feel seen as the person you are, it truly will give you wings to continue on your autistic journey, and having the courage to ask for your individual needs to be met and supported.